400 men were observed, documented and allowed to die over 40 years, all while doctors who could have saved them watched, took notes, and called it science. This is the Tuskegee Syphilis study. Welcome back to the lab, my curious test subjects. Today we are talking about one of the most disturbing experiments in American medical history. And trust me, that is saying something. Between 1932 and 1972, the United States Public Health Service ran a study in Macon County, Alabama. They recruited 399 black men who had syphilis and 201 men who did not. The men were never told they had syphilis. They were never told they were in a study. They were told they had something called bad blood, a vague term that could mean almost anything, and that they were going to get free treatment for it. Spoiler alert, they were not going to get treatment. They were going to be watched for 4 decades while the disease destroyed their bodies. And when a real cure became available, the doctors running the study made sure the men never got it. Let that sink in for a second. So what exactly were these men told? Let us go back to 1932. The Great Depression is crushing the American South. Macon County, Alabama, is one of the poorest places in the country. The Public Health Service arrives offering free medical exams, free meals, and free treatment for something the doctors are calling bad blood. Now, bad blood was not a medical term. It was deliberately vague. It could mean anemia, fatigue, general unwellness, anything really. The men who signed up thought they were getting help. In clinical trial terms, that means the men thought they were patients, but the doctors saw them as specimens. The study started with 399 men who had syphilis and 201 men who did not, a control group. None of them knew which group they were in. None of them knew they were in a study at all. The doctors did give them some treatment at the very beginning, low doses of mercurial ointment and a drug called neoarspheniamine. But these treatments were not designed to cure syphilis. They were designed to convince the men to participate, completely voluntary, obviously, and maybe prevent the men from infecting their wives. Think of it like signing up for a free health clinic, except the doctors were not there to help you. They were there to watch you deteriorate. The researchers wanted to document the full progression of untreated syphilis in black men. They wanted to see what the disease did to the body over years and decades. And to do that, they needed the men to stay sick. So the men were given just enough care to keep them coming back, and not one bit more. 400 men with syphilis, 201 controls, all of them deceived from day one. Now you might be wondering, what kind of treatment were they actually getting? Let me paint you a picture. The doctors wanted to perform lumbar punctures on the men. A lumbar puncture is like getting a spinal tap. Safe, minor, but unpleasant and nobody's idea of a good time. You get a needle inserted between 2 bones in your lower back to extract spinal fluid. It can leave you with a headache for days. So, how did the doctors convince the men to agree to this? They sent letters asking the men to come in for a special examination. They did not say lumbar puncture. They did not say spinal tap. They used the words special examination and free treatment interchangeably, as if the procedure itself was the cure. In clinical trial terms, that means they were being told the procedure was a cure when it was actually just data collection. Spoiler, it was not a cure. And as the years went on, the so-called treatment got even worse. The men were given spring tonics, aspirin, placebos dressed up as medicine. The control group, the men who did not even have syphilis, were also told they were sick and given aspirin. But here is where it gets truly unforgivable. In 1943, penicillin became widely available. It was a miracle drug for syphilis. More effective, easier to use, and far less toxic than anything that came before. The doctors running the Tuskegee study knew this, and they made sure the men in the study did not get it. Some men managed to get penicillin from other doctors who were not involved in the study, but many did not. The researchers even contacted local draft boards during World War II to ensure their subjects would not be called up for military service, because the military would have treated their syphilis. Let me say that again. They actively prevented the men from being cured. So how long did this go on? 40 years. 40 years is longer than most of us will work at a single job. And these men spent that entire time being lied to by people they trusted. The study began in 1932. It did not end until 1972. That is 4 decades of deception. 4 decades of watching men suffer from a disease that could have been cured. The doctors were not just passively observing either. They realized early on that their most valuable data would come from autopsies. So they offered the men $50 to help cover funeral expenses, on the condition that the family agreed to let the government perform an autopsy after death. $50 in exchange for cutting open your body to see what untreated syphilis did to your brain, your heart, your spine, in clinical trial terms. That means the experiment's success depended entirely on the subjects never finding out they were being used, and it worked for 40 years. By the time the study was exposed in 1972, dozens of men had died directly from syphilis. Many more died from complications related to the disease. Wives had been infected. Children had been born with congenital syphilis. All of this was documented. All of this was known. And none of it stopped the study. It only ended when a whistleblower leaked the story to the press, and the public finally realized what had been happening in Macon County for 4 decades. There was outrage. There were lawsuits. There was a formal apology from the president in 1997, 25 years after the study ended, and 65 years after it began. But no apology and no settlement could undo what had been done. You cannot give someone back 40 years. You cannot undeceive the dead. So, here is what we learned today, my curious test subjects. The Tuskegee syphilis study was not an accident. It was not a mistake. It was a deliberate, sustained, institutional decision to treat human beings like laboratory animals, to lie to them, to withhold life-saving treatment from them, and to watch them suffer and die so that researchers could publish papers about untreated syphilis. The men were promised care and given placebos. They were told they were sick with bad blood and never told they had syphilis. They were subjected to painful procedures disguised as treatment. And when a cure finally arrived, it was deliberately kept from them for 40 years. And all it took was 40 years of systematic deception, a government agency willing to treat human beings like lab rats, and doctors who decided observation was more important than saving lives. Progress. If this story disturbed you as much as it should, leave a comment, hit subscribe, and let me know what experiment I should cover next. Until then, stay curious, and maybe a little skeptical of anyone offering you free treatment. This is your mad scientist, signing off.